right,
immediately say that's the kind of person who's going to make a breakthrough.
right.
When I have somebody who says there is data showing that I'm right.
Right. I've already proven this.
I've already proven it.
Yeah,
nobody else reads it. Nobody else sees it.
Because the whole world
they're either evil or they're trying to
That's
keep profit.
Yeah.
Like that for me, whether it's right or wrong, that's too easy a road. That's not doing the work.
And where you're at and what you know there's to that. Like there's just like to be able to say it's proven in peer reviewed journals, you know what's real and what's not in that. That's a good distinction.
You know, and so I think a lot of medical people, scientists and medical people use the term articles, scientifically proven, studies that show, right? That to me is no different than, you know, us saying exists.
Yeah, I read it on the internet.
It literally is. That's not a qualification right now.
Right.
Because you have this just kind of explosion of places that are willing to put anything into their journal.
You could go all day and like go on the internet and read about like aviation, flying an airplane, but you sure as would not go into the cockpit and be like, I got this, right? But like, you know, with like somehow in medicine like that, and I imagine
so look, let me tell you a story.
Yeah.
Okay. I have to be careful how I say this because I really can't like I took care of someone who had a massive following around contrarian theories for cancer. And then they got cancer. And then they came to me to get taken care of. And this person who is sitting there with, again, not to say all contrarians are this, but this person explicitly stated to me multiple times how essential it is that nobody sees them coming in or out of the hospital, wow, that nobody sees them being affiliated with a hospital, because their entire enterprise was based on saying Western hospitals are evil, are doing all things for profit. You know, so there's your, you know, atheist in a foxhole, right? I mean, it's it's not saying some people don't live by this stuff and some people don't do it. I'm sure there are. But there are a lot of people out there on both sides of this coin who may have secondary gain from what they're doing.
For sure.
It's not just the pharma side. It's not just the contrarian side.
For sure.
There's secondary gain, and secondary gain can be conscious or subconscious. Not everybody is evil, but they start to believe things because they start to get traction when they say them.
Sure.
And
that either feels good.
That feels good.
Snowball effect. Yeah, for sure.
That feels good.
And what do you think, like, you know, I mean, you know, as far as like, you know, staying on the sort of lack of faith in medicine, you know, Pops always would say that, you know, as you get older and as you kind of get further in your life and especially if you advance in your career, the longer you're in your career, you start to realize that so many people who do what you do in any field are really like live in the level of like mediocre to like really bad. You know, I know that's true in my business, right? And he would use an example. I guess he was doing all that stuff with like scatter plans and dealing so much with aviation, like air traffic control and stuff. And there was like this whole thing he talked about called the big sky theory, where when you really get to know air traffic controllers and you start to talk about them, there's this one guy who did this interview with him, and they talked, and he said there's something called the big sky theory, and that is, you think, you know, we're responsible for all these planes up in the air at once, right? And like, we've got to live every day that if we make the littlest mistake and say to go off course one way or the other, it's like you could kill people. And the things that save us from that pressure is a big sky theory. Yep. Airplane's a teeny little speck in a giant sky. Yep. And the truth is, they make mistakes all the time, just like people make mistakes in every field that they do. And not even talking about good apples and bad apples and good teachers and bad teachers and good cops and bad cops, just people up.
Yep.
And to what degree would you say you see that in medicine? Are there doctors that truly suck?
So, there's two questions in that question, and I think they're both kind of interesting topics. I guess the first one is, do hospitals, doctors, medical personnel make mistakes that kill people? 100%. 100%. That data is out there. I mean, we know, and it's not a small number of people that get hurt in hospitals. There is a certain chance of something bad happening in a hospital. If you just think of it is people outside of their normal conditions, right? People are disoriented. They're sleeping in a hospital bed. They're not getting good sleep. They trip and fall. The nurse gives the wrong medication. The doctor orders the wrong medication. That stuff has to happen at some frequency. And the goal for us is to keep that number as low as humanly possible. Some hospitals are better than others. No question. The question about, are there just bad doctors? The history of medicine is a little bit interesting with this, because medicine is a different type of field than other fields based purely on its history. So it's actually kind of an interesting history. And basically prior to kind of the early 1900s, anybody could open a medical school. You could have the John Bernthal School of Medicine. You could teach people how to,
It's funny about that.
swing a baseball bat and say, that's what you do. When someone comes in, you hit them with a baseball bat, and that will totally get their problem solved, right? But that's when you get into ideas of like releasing the evil humor. You could start a medical school based on anything you want. And what happened is the government, actually, for all the people who say the government never does anything good, but the government got together and got this guy, Abraham Flexner, who was a physician. They said, go around the country and figure out some criteria you got to have a medical school, because we can't have these